2020 has been a very difficult year, but we actually have hope and we have optimism that there is actually the beginning of the end of the pandemic. And I strongly believe that vaccines are going to take us there. There's a lot of excitement, but there's also a lot of concerns that you have. And I want to try to address those today. These are messenger RNA vaccines. They're not live vaccines. They're not weakened forms of the virus. These are actually vaccines that help our body make a protein called the spike protein, which actually is a harmless part of the coronavirus. It's actually what the coronavirus uses to attach to our cells, and this enables our body to make antibodies should we be exposed to the coronavirus and provide us protection. mRNA is messenger RNA. We are composed of mRNA. mRNA technology has been used for decades, and now we're really at a very special time in regards to science and the pandemic. We actually have two effective mRNA vaccines that are available, and we believe that this is really going to be a safe and effective way to deliver vaccines. The vaccines are 95% effective in prevention of symptomatic COVID infection. So we've actually been extremely enthusiastic and optimistic about results of these studies and trials. 20,000 patients in both trials received the vaccine. There's actually a lot of reasons for why we've been able to get to the point we're at right now. For one, the mRNA technology has been around for decades and has been used in other types of treatment. We also know that the genetic footprint of coronavirus was released before we even saw a case in this country and really enabled companies to start working on vaccines at a much earlier time. Also think about when vaccines come to market, there's also the financial risk that's undertaken by the drug companies to do so. We know in this case, our government really enabled and provided the capital to do that. And the other really important piece is the mRNA vaccines. Again, they're not live viruses. They are much more scalable. You can produce them at a much quicker time, which enables us to get a quicker distribution system available. We as an organization, Trinity Health, and I as an infectious disease doctor, am confident in the safety and efficacy of these new vaccines. They've actually undergone all the rigorous review that a vaccine would normally undergo. And that includes review by the FDA, by the CDC, by the ACIP, the Advisory Committee on Immunization Practices, which is an independent body of public and medical health professionals. And through all these reviews, we have an emergency use authorization to allow use of these new vaccines. So we've heard that there are concerns that these new types of vaccines, the mRNA vaccines, can change your DNA. These vaccines do not have any live or weakened form of the virus. They will not change or impact your DNA in any way at all. The vaccines have been rigorously evaluated and studied in thousands of patients. The most common side effects are mild to moderate in nature. And what those are pain at the site of injection, redness at the site of injection, fatigue, headaches, chills, and in some cases, fever. If you have these side effects, it's actually a good sign. That means that your body's immune system is working and you're reacting the way you should to the vaccine. We know some of the side effects that have been reported. We talked about the most common side effects, and then there's concern about long-term side effects. When we talk about vaccines, it's important to recognize that serious side effects almost always happen early, within the first few weeks of administration. So we actually have quite a good sense of what's happening. There really are not serious side effects. And again, these vaccines don't involve any infectious part or a weakened part of the virus itself. Currently, there are two vaccines, the Pfizer vaccine and the Moderna vaccine. Remarkably, the vaccines are actually very similar. They both are mRNA vaccines. They both have special types of cold chain requirements. And when you actually look at the data is actually very similar. They are both 95% effective in prevention of symptomatic COVID infection. The dosing schedules are a bit different, but actually remarkably similar in terms of efficacy. We know that there is vaccine hesitancy and a lot of concerns about taking the vaccines in specific communities, including the African American, the Latinx, and other minority populations. But I want to assure you, we want to assure you, Trinity Health, that the vaccines are safe and effective, have actually been studied in those groups, well represented in the trials that have been done thus far. And we will strongly recommend that these communities take the vaccine to really protect them from getting COVID, which has really disproportionately affected and impacted those communities. I did receive my vaccine, the first dose. It was actually quite emotional. 2020 has been a very difficult year on many different fronts that we've all experienced. This is the beginning of the end of the pandemic. We can see a ray of hope, and we're going to get there, and 2021 is going to be much, much better. I'm extremely proud and enthusiastic and optimistic about where we're going. 2020 has been, we haven't had a pandemic like this in over 100 years. I mean, none of us were around, and this has been a very difficult year on many fronts. But I am extremely proud of our healthcare workers, our communities, in terms of our response and how we've managed this. And look at where we are. We're on the forefront of the beginning of the end of the pandemic. This is really an exciting time.